patient number 2, where it says osteotome used to elevate sinus by, it looks like 1 millimeter. You had mentioned to me unequivocally that the osteotome method is not part of the Sargon implant protocol. Do you remember that?
That's correct.
Okay. You watched Tessam Nowzari put in the first 22 cases, is that right?
That's correct.
And he did not use any osteotoming?
Not at that time.
Okay. And when you say not at that time, is it because you know he's used it some other time?
No, I mean, I see it now.
Okay. And again, just because this says patient number 2 does not mean that you were there to
That's
witness
correct.
this, because they may not be
That's correct.
sequential. You said that osteotoming is a method by which the bone is compacted with a particular implement, right?
Instrument.
Instrument.
Correct.
And when you say compacted, it's compressed, right?
Condensed.
Okay, and why is osteotoming not permitted for use with the Sargon implant, if you know?
First of all, I have no experience with it. You know, the osteotoming
Okay.
method. It's because it was something introduced, and the main reason it is not it's not something what Dr. Sargon recommended in his method. Okay, I'm speculating why. I never discussed with him why he doesn't like osteotomy. But the whole idea of the Sargon system, that when you insert the implant, okay, and start to expand in it, then you get a feedback whether this bone is solid. So the bone has to be solid naturally in order to screw to it something. So by this condensation is perhaps immediately condensed. It's not real. You pack in something now.
So it's an artificial manipulation of some bone, which may or may not be good.
You have to ask Sargon about this.
Okay, well, I'm just asking you whether you know why it's not permitted, but you know
no, it's
that...
not in the protocol at all.
Okay.
It's not in the protocol. It's you're supposed to drill, place, expand.
Okay.
You're not supposed to compact.
Would it surprise you to learn that Dr. Nowzari performed surgeries recently in Switzerland using the osteotoming technique?
With the Sargon system?
Yes.
I don't know.
Well,
I didn't hear the witness's comment, I'm sorry.
okay.
Can you say that again? What you just asked?
I did not know.
He didn't. Okay.
I did not know.
Okay.
In your experience and what you've seen, I think you have some experience in this. What happens when the osteotoming technique is used with the Sargon implant?
Objection. He just stated he's not familiar with the technique.
No, he has seen osteotoming, I think. Didn't you tell me yesterday?
I've seen an osteotomy procedure, but I'm really not very familiar with the biomechanics and the biology of it,
Okay.
to be honest with you, especially with the Sargon system. I really don't.
Well, have you heard that the osteotoming technique causes failure in the Sargon implant?
It's very possible, but I'm speculating. Yeah.
Okay.
Move to strike.
Dr. Abu Ras, do you know what the term patient abandonment means?